a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Do the math. At Oak Mountain Academy, our average graduating class has just 12 students. We celebrate a 100% graduation rate with more than $10.5 million in college scholarships offered. Plus, 96% of our students are accepted into their top choice college. Do the math. Can you see the value of an OMA education? I'm Patrick Uran, head of school at Oak Mountain Academy, and I'm here to help you do the math. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
National headlines and the local stories you care about. WLBB, Carrollton, News Talk 1330, FM 106.3.
And good morning. Welcome to the Community Voice. Today is Friday, May 15th, and I'm your host, Josh Engel. Today we have Dr. Timothy Thomas in the studio with us today. May is Stroke Awareness Month, and Dr. Timothy Thomas is a board-certified emergency medicine physician with Carrollton Emergency Physicians, who serves in the emergency departments at Tanner Medical Center, Carrollton, and Tanner Medical Center, Villa Rica. He earned his medical degree at Des Moines University School of Osteopathic Medicine in Des Moines, Iowa, and completed his internship and residency at Doctors Hospital in Columbus, Ohio. He is a certified provider of basic life support, advanced cardiac life support, pediatric advanced life support, and advanced trauma life support. Dr. Thomas is also currently the medical director of 3 local emergency service entities, West Georgia Ambulance Service, the Carroll County Fire Department, and the Carrollton Fire Department. His wife, Katie, is a physical therapist, and they have 2 children, Josie and Andres. Am I saying that right?
On Andrew. I don't know why it says Andres.
Oh, boom. Well, now his name is Andres.
He's going to love that if he hears this.
I love it. Josie and Andrew. Pardon that, Andres. Andrew. During his leisure time, Dr. Thomas enjoys fishing, golfing, softball, snow skiing, and taking his kids to baseball, taxing his kids. Soccer and riflery. He also enjoys landscaping, cooking, home improvement, Pittsburgh Steelers football, and Mississippi State University football. Go Bulldogs. Hey, I'm a UGA grad.
Oh, that's good. Yeah, you're another Bulldog. I'll take it.
The other ones.
Yeah.
Dr. Thomas, good morning, sir.
Thanks, Josh.
Appreciate your patience as I read through your background. I'd like to make sure everybody knows kind of who you are. So since we covered the origin story, maybe you could tell us a bit about why you got into medicine in the first place.
Oh, geez. Well, actually, it's funny. I started as a architecture major at Mississippi State, which is kind of interesting. So I was part of the studio there. You know, they have hundreds of applicants, and I was one of the 50 in the studio. And going through my first semester, I had an A. Like, I was doing great. And I just, at like winter break, I had this fear that hit me of, like, I'm going to be stuck in a cubicle drawing the same hotel plan over and over again.
Lurching over
exactly,
blueprints and CAD.
So I was like, so it's more of a hobby. I enjoy design, and I enjoy that, but it's not. So I went into pre-med, and that's how I got there. I mean, it was kind of a weird, pre-med or architecture. I don't know. I don't know why I had those two in mind, and I ended up going pre-med and then went to emergency medicine. So,
well, I can't wait to talk to you in 10 years when you're designing hospitals.
I don't think that'll happen.
We're not going to get you stuck at a table, man.
No.
You're too important. You're doing too much stuff. I mean, it's a perfect time to bring you on the show. May being Stroke Awareness Month. Maybe we could just kind of start at the beginning. What is happening during a stroke, and how common are they?
Oh, well, first of all, stroke. I mean, I make things simple. When people see me in the ER, it's the same thing. Like when I'm talking about heart problems or brain problems, strokes. There's really 2 kinds of strokes we talk about. There's busted pipes that are leaking, and there are clogged pipes that need opened up. That's the 2 different kinds of strokes. So the hemorrhagic strokes are the ones that are usually related to hypertension or some structural abnormality in the heart, or in the brain, where artery ruptures and you bleed into the brain. That's usually, like I said, somebody that has hypertension that's uncontrolled, that kind of thing. The ones that people think about mostly of stroke are what we call ischemic strokes, or blocked pipes is what that is. So when that happens, we risk brain cells. You know, the human brain has 86 billion with a B neurons, which are the brain cells. And for every minute that you're having a stroke, specifically an ischemic stroke or a blocked pipe, you can lose up to 1.9 million with an M neurons every minute. So what we're trying to do when we're trying to stop a stroke is we're trying to prevent that loss of brain. So yeah, 86 billion is a big number, but the longer you wait to intervene, the more brain cells you lose because of lack of blood flow. So that's kind of what a stroke is. It's either a blocked pipe or a clogged pipe. A clogged pipe or a leaking pipe is the way I like to explain it to people.
How common are they?
More and more common, unfortunately, and we're starting to see it in younger people. It's actually still the leading cause of disability and death in the country. Over heart attacks, cancer, it's still stroke. And one of the reasons we're seeing an increase in younger people is because of hypertension that's uncontrolled, obesity, just a sedentary lifestyle, smoking, stimulant use. You know, there's a generation now that their new drug is just caffeine. You know, you look at these ridiculous, sports or energy drinks that have 7,000 milligrams of caffeine. It's crazy.
Why do they have like radiation symbols?
Yeah,
and stuff
exactly.
They all
look like they might kill you. But
so
I'm going to drink that. Why not?
Yeah. Yeah.
So, but unfortunately, like I said, we're seeing it in younger people.
Wow.
I think the youngest stroke I've seen that was an ischemic stroke was in their early 20s, which was sad. They got intervention, but still had some residual problems from it.
My
some
God.
Disability, yeah.
So this is an important message. I was unaware that caffeine, played a role. What are the contributing factors?
Stimulants, right?
Stimulants.
Methamphetamines are stimulants too, if you think about it. Right?
Good point.
So, yes.
Good point.
People make bad decisions when they use drugs. So
yeah, for real. So it isn't. I think that a lot of folks, when they think of strokes, they're uninformed. They may not know. They think of strokes as like, oh yeah, my great aunt Bertha, she had a stroke when she's like 68 or something. It's like, no, that's not necessarily the case.
Yeah, no. And the older you get, Josh, that number gets further closer. You know what I mean? Like I'm 47. That's not that far. I mean, there's people that have it in their 40s, 50s, 30s. It does happen. I mean, obviously it's not the vast majority, but that's why it's important to, get your regular checks, see your doctor, make sure you're controlling the things you can control. Smoking is probably one of the biggest risks. People smoking not only for strokes, heart disease, smoking is the biggest risk for any of these. And if you stop that, that's a correctable cause, right? You can't fix bad genes. You can't fix that you have hypertension I have marathon runners that have hypertension, I see. Sure. You look at these people, there's no way they have hypertension. They come in, their blood pressure's through the roof. Yeah. So don't think that just because you need to check with your doctor and get evaluated and make sure you don't have high blood pressure. Don't assume because you're healthy that there's not something that needs to be looked at. And I'm by no means a pushing the drugs type person. So.
Well, sure. And not that I work for Big Tobacco, but I want to follow up. Have you seen, my own curiosity's sake, have you seen any peer-reviewed studies on vaping, like people have nicotine vapes?
Vaping puts a risk too. I mean, because the nicotine is the problem, right?
Yeah.
It's not necessarily as much when you smoking's too, like when you talk about the chemicals in the cigarettes, that's what causes all the cancers and all that. That's also in the vapes. They have chemicals in the vapes, but the nicotine is the problem because it causes vasoconstriction and other things that can contribute to the stroke.
Absolutely.
Risk. Yeah. So it's not just the nasty chemicals in the cigarettes. It's also the nicotine is the biggest problem. Absolutely. And that's in the vapes as well.
So before we take that first commercial break, can we break down how to recognize a stroke?
Yeah.
It seems like the expression, the acronym is be fast.
Yes.
Can you kind of break that down for us?
It used to be just fast, but now we want you to be fast. So B, when you're talking about sudden changes in people's balance or coordination, someone's reaching for a coffee cup and they keep dropping it, or they're trying to feed themselves and they keep missing their mouth. That's the coordination part of it. Or simply every time they stand up, they keep falling off to one side. Those are the kind of things you look for. Eyes, obviously, the E is the eyes, so loss of vision, double vision, visual changes can be concerning. There's some stroke mimics that cause that too, migraines, but obviously it's all looking at all this. The F is for facial drooping. So if they smile and their smile's not even, or they have droopiness of their eyes, that's a concern. A is for arms, which is weakness, numbness, especially on one side. So if the person has unilateral arm weakness, and leg weakness counts too. I mean, they use A because it fits in fast. I don't think R would work as well there. So, or leg, L, sorry. And then speech is the S. So obviously trouble with speech. And there's different kinds of speech problems. There's either people that are not able to speak, so they're struggling. You can tell they're struggling to get out their words, or what we call like a word salad, which is a certain kind of aphasia. So in other words, they look at you and say, "It's a beautiful spaghetti today." and wait a minute, that didn't make sense.
Mixing up a bunch of thoughts at once. It's all
and typically when people have that problem, you can see it. Like you can see it in their eyes, like in the ER when I see somebody with that, you can tell there's a they're concerned in their eyes, like, I don't know why that's saying that. That's
you're not assuming it's some new Gen Z slang.
Something my daughter texts me and I can't. Yeah, totally. I'm
all about spaghetti.
Aura farming over here. What's going on?
And Doc Maxing over here.
Yeah, exactly. And the T for be fast is time. So call 911 immediately. I'll say this more than once. Don't get on Google. Don't chat GPT. Don't tick face, InstaSnap, Faceagram, all those things that I don't have or have any interest in. Those don't give you the right answer. The right answer, if you see signs of a stroke, is call 911 so we can get you taken care of.
Because how can a Google search or a ChatGPT report, how can it compete with 20-something years of experience?
Well, yeah, for me,
Plus, how
I always tell people 24. I tell people 24 years of education between high school, college, medical school, and residency, and then, it's 2026. It's 20 years of me doing this now, including residency.
We're giving up your age here.
Yeah, I know, it's getting old.
So don't trust Doc GPT or whatever. Just trust the professionals. Call 911, and maybe they definitely can help you out, take care of you. So time is 8:40. We're going to go ahead and knock out that first commercial break. And then we'll come back and continue our conversation with Dr. Timothy Thomas. A quick reminder to folks that are tuning into this morning's program, if you have any questions or comments for our guests, Dr. Timothy Thomas, as we discuss Stroke Awareness Month, this episode is being live streamed on our WLBB News Talk 1330 Facebook page, as well as our Grad Communications YouTube page. So feel free to share that link, spread the good word, let folks know about Stroke Awareness Month and how they can be up to speed and informed should one of their family members or themselves find themselves in this situation. So definitely spread the good word. And if you have any comments, feel free to hop in the chat. Community Voice is brought to you by Tanner Health and Oak Mountain Academy.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy specializes in a customized designed academic approach tailored to meet the needs of our families. Our lower division prepares students with the necessary foundation to build excellence. Our middle division provides students with over 15 course offerings, providing them with opportunities to explore their talents and gifts. Our upper division provides personalized academic journeys, allowing them to achieve their dreams. I'm Patrick Uran, head of school, inviting you to journey with us. For more information, visit us at oakmountain.us, where every path leads to purpose.
And we're back to Community Voice. Today is Friday, May 15th. If you're just tuning in with us, this morning's episode about Stroke Awareness Month. May is Stroke Awareness Month. The episode with Dr. Timothy Thomas is being live streamed currently on our WLBB News Talk 1330 Facebook page, as well as our Grad Communications YouTube. So if you have any questions or comments for Dr. Thomas, feel free to hop in the chat and leave those comments. We'll be happy to ask him. And, of course, share the link. Share the link to the live stream. Let folks know what's going on. Dr. Timothy Thomas is a board-certified emergency medicine physician with Carrollton Emergency Physicians. Serves in the emergency departments at Tanner Medical Center Carrollton and Tanner Medical Center Villa Rica. We've been chatting a bit more about what strokes are in detail, as well as recognizing a stroke. So if you missed that first segment, go check it out. So let's jump right back into it there, boss man.
Yeah. So one thing I meant to mention a minute ago, before we did the commercial break, is being with the EMS, I want to talk about, there's different kind of stroke centers. There's primary and tertiary. Tanner's a primary center. So we do intravenous intervention for strokes. When you talk about tertiary, you're talking about going into some of the bigger hospitals at Atlanta. We have an agreement with Grady. Most of our ones that go to tertiary are going to Grady. But one of the exciting things that's coming is we're in the process of making an agreement with Grady to take part in their mobile stroke unit, which is, we were talking about it earlier, and it's kind of cool. I want to tell people it's coming. So there's a big truck they have, basically a big ambulance that has a CT scanner in it. So when people meet certain criteria, time is brain. So the faster we know you have a stroke, the faster we can get you the right intervention. You may go to Tanner first, and then we give you the TPA and then do the CT of angio, which looks at that where that blockage is. If it's a large vessel blockage, so one of the vessels that they can get to and actually pull clot out or open it up with a stent like they do a heart attack, that's when they get sent to Grady often. But what we can do in the field now is, with this agreement with Grady, they can meet this truck that has a CT scanner in it halfway to Atlanta, transfer the patient to the truck. They get the CT scan. In that truck, they have every medicine we would have in the ER. They have a nurse that can give it. There's a neurologist there doing telemedicine, examining the patient on the way to that truck. It's kind of an exciting thing for me from an EMS standpoint, and I think it's going to provide great service to community. Also get our trucks back in the county to serve the people here quicker as well. So it's just kind of something exciting coming, and that should be coming in the next couple months. We're kind of finishing it out with Grady, but it's just kind of a neat thing I want to throw in.
And it's comforting. It's comforting for listeners to know. I mean, that this is the direction that modern medical science is taking. I mean, it's incredible that they fit, basically a mini emergency room into a helicopter, and for life flights. But to have this, to be able to cut that time down and increase success in treatment, I mean, that's a massive thing. Thank you for telling us.
I was just going to point it out because we didn't get a chance to talk about it earlier.
Well, that's amazing. So keep an eye out on that. I'm sure you'll be seeing posts and stuff about that as it is finalized. We were talking a bit about noticing strokes. So what's the biggest mistake that people make when they notice symptoms?
The biggest mistake is people think that it's, I just slept on my arm wrong, or let me take a Tylenol and see if it gets better. I'm
hungover.
I'm just hung. Yeah, there's always, I always say to people, I even say it in the ER, I say, are you Egyptian because you're living in denial? Let's talk about the problem, right? So, sorry, dad joke. I got a ton of them. I got a great one about snowmen and smelling carrots, but we'll go later.
We need them.
Yeah, exactly. So, but I mean, literally, that's the biggest problem people delay. And I mean, once you get past a certain time frame, we can't help. You can't, because you run the risk of taking we talked about earlier, the ischemic or the blocked artery. If you do something after too much time, you then can convert it to a bleeding artery, and those are much worse. Typically, the outcomes are worse just because of the pathophysiology involved. So the quicker when you see stroke signs, you need to go get it evaluated. And it's okay. That's what we do. I see people that have stroke signs and they go away quickly. That's called a TIA, or transient ischemic attack, a mini stroke, as people say. So we're in the ER. We're there to see you. We're there to take care of you. EMS is there to assess you too. Use us. That's what we're there for.
And I mean, and just to be clear for listeners, if you feel that you may be experiencing signs of a stroke, or you're noticing signs of a stroke, should you just call the ambulance? I mean, should you attempt driving yourself?
I would not drive it yourself on the off chance it gets worse. I mean, 911 is the answer. Now, if you have a family member, and this is me, if sometimes because of where you are, you might be 2 blocks from the hospital. Yes, drive. That's fine. We have walk-in strokes all the time. We have ambulance brought as well, but either one is fine. But obviously, you should not be driving yourself.
If you think you're having
a stroke, do not get in the car and put it in drive, please.
Too many people have car accidents fully aware.
Yeah, with the ability to use their right arm and speed.
Yeah,
so
we don't need that. We don't need that. Maybe there'll be less road rage. People won't be screaming at each other. Yeah. So, all right. So outcomes. And clearly you've established that making a move fast, acting on the symptoms fast, will make a big time difference in terms of saving lives. How does the speed of receiving treatment change the outcome? You've touched on it.
Well, it's kind of what we talked about earlier. It's that loss of neurons or brain cells. The longer that clot. And again, we're talking mostly about ischemic strokes now. The bleeding strokes are different. Those are kind of more damage control, truthfully. And that's why you make sure you're taking care of your hypertension. You're not smoking. But the occluded arteries, they're the ones that the quicker we open up, the quicker you get blood flow downstream, those neurons don't die. So you keep more brain function. You don't have the residual side effects. I mean, people can have stroke symptoms. We break up the clot and completely resolve. Then obviously the recovery afterwards, which we provide at Tanner as well, is the important part too. I mean, when people have strokes, if unfortunately they didn't get to us in time, or they don't have good return of function after we do rehab. Of course, my wife's a physical therapist, so I'm going to push the rehab. Rehab is very important to help get back what you can.
Absolutely.
The brain's plastic. You can get better, but it's not. You can't fix the damage once it's done.
Well, and that was my next question. Could stroke damage be reversed? I mean, through rehabilitation and physical therapy, some motor functions and stuff. But
it all depends on where it is, how big it is, the length of time. Because even after the stroke's fixed, sometimes you still have what we call an ischemic penumbrum, which is just there's some area that we didn't see initially on the CT that gets a little worse. Sometimes it's all a crapshoot. But the answer is get to us quicker so we can get it intervened quicker.
Whoa. Yeah. Penumbrum sounds like a Tool album.
Fancy name, isn't it?
Penumbrum. Yeah. Check that out.
Try to spell that.
Yeah, for real. Wow. All right. Well, so as far as risk factors, we touched on things that aren't going to help you, in terms of obesity, sedentary lifestyle, vaping or smoking cigarettes. Are there any that we're missing? Other big risk factors.
Atrial fibrillation is a big risk factor, but that's why we do the things when people have atrial fibrillation or AFib or a regular heartbeat. That's why they're on blood thinners, to prevent clot formation, because those clots can sometimes go out of because if the top of your heart's just fibrillating or twitching instead of squeezing, that's what AFib is the top chambers of your heart just kind of twitch instead of squeeze. Blood tends to clot there. That's why they're on blood thinners. That's what we do to prevent that from an AFib. But that's a risk factor we didn't talk about. High cholesterol, obviously, because these, just like in your heart, those plaques, these blockages can be made out of cholesterol. Hypertension, as we spoke, smoking, obesity. Yeah, it's the things we kind of talked about.
Well, we have a comment here that just came in before we jump to that first commercial break from Scott McClure. Scott, I appreciate you tuning in on the live stream and giving us a comment today. Scott says, I appreciate you. I truly do. I hope you have a great day. Thank you guys very much. I was hit by a driver having a possible stroke about 2 months ago. I was a medic, so I recognized what was going on with the guy and told the sheriff's patrolman, and they need to get an ambulance down here for him.
That's awesome.
Fast move, yeah.
Great job, Scott. Awesome, yeah.
See, he knows about be fast.
Yeah, he does.
He's recognizing a stroke. Balance, you see a sudden loss of balance. E for eyes, vision problems. F for face, drooping on one side. No, this isn't for you, Scott. You clearly know. But for other folks, just a quick reminder. If you see a drooping on a side of the face, arms, weakness or numbness in the arms, and, of course, speech, slurred or strange speech. I want to check in with that. And, of course, time, call a T for time, call 911 immediately. And don't drive yourself.
Correct. Yeah. Scott knows that.
Scott knows that. Scott knows. Scotty knows. All right. We're going to go ahead and take that last commercial break. But when we come back, we'll continue our conversation with Dr. Timothy Thomas as we discuss Stroke Awareness Month for the month of May. Community Voice brought to you by Tanner Health and Oak Mountain Academy.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy is a vibrant community built on innovation, academic excellence, and a 64-year legacy of shaping community leaders. I'm Patrick Uran, head of school at Oak Mountain Academy, inviting you to visit the mountain and experience firsthand the passion, purpose, and personalized education that defines our school. Come see how our mission and vision come to life each day. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
And we're back to Community Voice. Time is 8:52. If you're just tuning in, a quick reminder that this morning's episode with Dr. Tim Thomas, as we discuss May's Stroke Awareness Month, is currently being live streamed on our WLBB News Talk 1330 Facebook page, as well as our Grata Communications YouTube. So feel free to share the links to either the live stream on Facebook or the YouTube live stream to your Facebook, to your social medias, wherever. TikTok or Faceagram, like you were talking about earlier.
My kids love it when I say that.
Oh, I bet they do. They're like, "Oh yeah, you're real hip."
Yeah.
Feel free to share the link, spread awareness. We've been talking a bit about, of course, recognizing a stroke. We discussed that in the first and second segment. Spoke to the importance of why speed saves lives. Why it's an important thing to try to act quickly. Notice the signs. Of course, tons of great information from Dr. Tim here. He's really filled us in on a lot of stuff. So maybe we could jump into more about risk factors. Just then, we chatted a bit. Cholesterol, caffeine. Other not amphetamines. What's where I'm looking? Stimulants. Other stimulants.
Smoking.
Yes.
AFib, like we talked about.
I think honestly, I think that we probably just sort of answered the question I was about to ask. If you think about it, but what are steps people can take today to reduce their risk? Probably stop smoking immediately.
Stop smoking immediately or vaping too, in my opinion. And not just mine, but medically. Exercise. Exercise doesn't mean you're doing CrossFit. bro, you don't have to be a CrossFit bro. You can just walk. Get out and exercise.
Don't be
walk.
worried about getting too swole.
Yeah,
Just move.
Cutting your sleeves off and wear it as a headband. That's the gyms I walk into. Like, where's your sleeves? Oh, they're on your forehead.
Yeah.
So, but no, get out there. Get some exercise. Walk. It's beautiful outside. We've had beautiful weather. Get outside and walk. Lose a little bit of weight. Kind of watch what you eat. I mean, those are the simple things you can do. But again, it all goes back to like we talked about when it comes to a stroke, recognizing the signs, making sure you're aggressive with seeking treatment. So. Somebody.
Oh no! Yeah, I saw something pop up. I thought maybe it was another comment, but it was someone tuning in.
Oh, okay.
That's awesome. All right, so and one more time, I know, folks, we touched on this a bit in the first segment, but if you could just sort of rehash, warning signs, things that you don't even got to go down the acronyms, but if you're hanging out with somebody and they start doing these things.
Oh, like I said, it's the be fast is what it is. But I mean, obviously, coordination's a problem. If they all of a sudden they're reaching for their phone and they keep dropping their phone, that's a problem. That's something you should notice. Yeah. If they start shaking their head and they're like, why? I have double vision, I can't see. Those kind of things. If you notice all of a sudden they can't reach for the door with their right hand and they don't reach for something with their right hand because they can't move it. Those are the kind of things. Just be cognizant of that. Speech is a big thing. A lot of times, those are the ones that are usually the ones that people pick up on the quickest, because if all of a sudden I'm having a conversation with you and I don't make sense or I'm kind of stop speaking, that's the one that people often pick up on first. I mean, and those are the major ones. It's just recognizing it, be cognizant of it. And again, the one thing I like to tell people is, I hear it all the time in the ER. They come and say, "Oh, I'm sorry, I'm wasting your time. There's nothing." No, it's not. There's nothing wrong. There could have been. And luckily, we found nothing wrong, Or like I talked about the TIAs, the mini strokes, the transient ischemic attacks. People do have stroke signs that resolve rapidly. Historically, it's always been documented as 24 hours. But the reason it was 24 hours is, guess what? You get admitted to the hospital, and then 24 hours later, when the doctor would come back around on you again, your symptoms were resolved. Yeah. But they really resolve quickly. That's what a TIA is. TIA are stroke symptoms that were resolved quickly. Think of it like chest pain of the brain. It's like you have chest pain. If you have chest pain, say you better go get checked out. You might have a heart attack. Stroke symptoms, you should think just as seriously as a heart attack. If you have stroke symptoms, you should go get it checked out. Because if it is maybe you're lucky and it's just a TIA. That's a warning sign that we need to do some further workup and see what your risk factors are and modify them. So just be really cognizant of the signs you see.
So we got about 3 minutes left in the program. For my own curiosity's sake, before we get to the last question, do you foresee any exciting updates to the treatment of strokes, just from the literature that you read?
I think right now a lot of the things, like the things they're doing at the tertiary care centers, are really cool. You got to think about how they treated heart attacks, decades ago, that they didn't have intervention. Now they've expanded that into the interarterial intervention here, and that's only going to get better and more advanced. We kind of badmouth AI a little bit, but what's kind of interesting is they use AI to quickly identify these occlusive strokes. Like when we have a CTA or an angiogram of the brain and neck sent over or done here, it goes immediately to Grady, and they have an AI that reads it. Now again, they're looking for specific things. I'm not saying AI is better than a radiologist, but it might be quicker if the radiologist is tied up and then they send a signal. So that's kind of cool. They're using AI for that. I think for the imaging, it's really neat.
And keep in mind, this isn't ChatGPT we're talking about.
No,
this is trained. Johns Hopkins trained
this
AI.
Is a real AI.
Finding cancer cells years before they metastasize or whatever.
Yeah.
I mean, it's incredible technology. Yeah. And I think that's exciting. And that speaks to the future of treatment. It's all moving faster at identifying mobile units.
Like we talked about, identifying quicker, intervention quicker, saving brain. Less long-term disability, hopefully getting back to normal, even if you have a stroke.
Absolutely. So we only have a couple of minutes left here. Two questions, but I'll present it to you as one. If listeners were to remember one thing from today, what should it be? And what would you say to someone who thinks this won't happen to them?
I'd say don't wait. Don't Google. Don't ChatGPT. If you're having stroke symptoms, if something isn't right, if it clicks true on the Be Fast, call 911. Get help. Get evaluated. If you're wrong, it's okay. Nobody comes in the ER worrying about a stroke and I say, "Why'd you waste my time?" No one does that. We're here to help you. That's what we want to do. That's why I went into what I do. So don't waste time. Come to the ER. Get evaluated. Also, like I said, our EMS is trained very well here, and they do a good job of assessing and deciding where you need to go, and they get you treatment as quick as they can. We want you there as quick as possible. Definitely less than 4 hours, because that's kind of the window for the intravenous TPA. So
perfect. Well, we're out of time here. For more on the signs and symptoms of stroke, and to learn more about stroke care at Tanner, Visit tanner.org/stroke. That's tanner.org/stroke. I think that's / there.
I believe so.
I believe so. I've never really known the difference, but tanner.org/stroke. Get information. Trust the professionals. Dr. Tim, thank you so much for coming in today. This was awesome, man.
Thank you, man.
And I appreciate everyone who tuned in with us today on the YouTube page, as well as our Grad Communications News Talk 1330 Facebook page. Tuned in with us on the radio. Thank you all, and I hope you all have a great weekend. We'll see you next time.